Welcome back to Living Vividly. I'm Jackie Hedich.
And I'm Daphne Olivier.
Today, we are joined by Dr. Navita Gupta, a board-certified internal medicine physician with over a decade of experience in traditional medicine, who recently made the courageous decision to step into functional medicine. Dr.
And beyond.
Dr. Gupta is also the wife of a previous podcast guest and Health Revolution panelist, Dr. Jacob Rowe. And today she shares her own journey, what led her to question the conventional model, how her perspective on healing has evolved, and why she felt called to practice medicine differently. We're so excited to have you.
Thank you.
Welcome.
Thank you so much.
So you spent a decade practicing traditional allopathic medicine. Was there a specific moment or a series of things that that made you start questioning whether you were really treating patients correctly or that this model was working the way that you were hoping that it would work?
Absolutely. I think I was trying to think of when, if there was a specific moment that happened that made me shift into this thinking. But if I had to say something, it'd probably be around when we were going through the initial part of the COVID pandemic. I don't know if it was God or life or what happened, but I was surrounded by all of these very strong women at that time, a neighbor, a very good friend who was a fitness instructor, who all started asking a lot of really good questions. We all started asking about the immune system, and we all started wondering what makes some people more susceptible than others, what's happening, why is this causing so many problems? And then came this burst of supplementation where, everybody is start talking about, I'm taking, coming in with 10, 12 supplements that they're on based on what their friend recommended. And these women in my life would ask me, what do you think? And in that time, I'm going to be honest, I didn't know. I didn't know what was going to make a difference. I knew some of it as far as chronic illnesses and knowing just those diagnoses are associated with it. But I didn't have the solid answer of the inflammation behind it, what it was doing to the immune system that was driving some of this. That was probably the biggest moment of saying, I need to learn. I need to go back and open up my eyes, because I was practicing from what I want to say is a toolkit that was small. And you go through 4 years of undergrad studying as a biologist, right? Then traditionally with pre-med classes intertwined in there. Then you do 4 years of medical school, and then you have residency training, and then you start to practice, right? So you have so many years where you've seen this data. You remember learning these processes, how the inflammation and this works. But you start working from a very small toolkit of just treating the endpoints. And that's, I want to say that was probably when it began.
And to be fair, the immune system's not a simple thing. It's very complex, lots of players. And so I have a friend that went through medical school, and she kind of a little bit later in life, it wasn't her first career. And she basically described medical school as you go in, you cram something in, learn it for a test, and then just vomit it out. To say that you really understand every aspect of it and carry that over into the next phase of learning is probably not realistic, and because the immune system is so complex, if you're not going through those systems and looking at the pathways often, then it's kind of easy to let some of that go. So unfortunately, I think COVID did a lot for a lot of people to kind of realign and say, okay, what actually is happening, and let's look at those pathways again.
Exactly. I think it's when we talk about the practice of medicine, I think that's really it. You're practicing from what you know and building upon there. But I think if we stop learning and we think that we know everything, that's the biggest failure that I'm seeing. And honestly, I'm sure both of you're doing this podcast and in your own lives, as you learn more, you're opening another door to learn. It's endless. Mm-hmm. So, but I think
unlearning too.
Yes, exactly. So I think that's where the lens has been now of my toolkit needs to be a lot bigger, And my eyes need to be open. My ears need to be much more open and meeting people where they are.
Yeah, I think COVID did that to a lot of people. And not to mention, I'm sure a lot of physicians feel constrained by like the time that they're allowed to sit with a patient with the traditional like entrance model. And there's so many things that you're limited and you can't dig very deep with patients.
Exactly. The traditional model still, which I'm still within a practice now of practicing within some time restraints, but traditionally it's 30 minutes for a new patient visit, and 15 minutes for anyone who's coming back to see us. That's how it's built. We fudge that quite a bit in practice. Most of us will spend, you come to see a primary care physician. Reality is you have a list. You pull out like a notebook and you sit with somebody. And most of us who have decided to go into primary care, you're working with that list. And yes, administration might not like the time you're spending and the delay on the other end, but it's people.
Right.
And this is we have to take better care of each other. And so it does make it difficult, but it's a big responsibility that we have.
How would you define in the maybe like the shortest or most descriptive way possible the difference between traditional medicine, allopathic medicine, and functional medicine?
There's actually a really beautiful diagram that the Institute of Functional Medicine has where it's a tree. And, functional medicine, they comment that the idea is that you're focusing on the root cause. So in traditional medicine, you learn about certain symptoms that someone's coming in with, what they're complaining about. You're running the blood work and you're putting those diagnoses and labels based on the cardiovascular system, the endocrine system. When you look at it from a functional medicine perspective, it's not that you're coming with a different set of diagnoses based on that, but you're looking at the pathways that led to get to that. To get to those, we don't like to call them diagnoses in functional medicine. We call it more conditions because we're hoping that they are conditional. And so it's looking at going back into almost your first 2 years of medical school and looking at the pathophysiology that has been there. We know the research that has been there, but we have put our toolkit into what is the medication to treat those conditions versus looking at how else can we approach this? You look at systems. Functional medicine has it's a beautiful kind of way it sounds very simple and obvious, but when someone comes into your office in primary care, functional, traditional, whatever you may have it, history has always been the key. That's kind of led you through this. The way you learn it through functional medicine is they call it antecedents, triggers, and mediators. You basically create a timeline for your patients. Antecedents are kind of referred to as like what happened probably when you were in utero or around the time of conception for you with mom. How was she? What was that like for her? Was it a stressful pregnancy? Was she sick? Did she require antibiotic usage? All the way to your birth. Was there a prolonged rupture of membranes? Mom needed IV antibiotics, which then subsequently affected your exposure. How were you born? Vaginal delivery versus C-section. Vaginal delivery allows a lot of exposure to a really good, healthy microbiome in the vagina that is not going to be seen with someone who's born via C-section. We look at that time of that first wash, that first bath that we do for babies now, right? You have the option to say, you don't wash the baby, don't take baby out and don't wash baby. Let all of that flora, all of those healing ingredients stay on the baby a little bit longer. So they look at the antecedents. The triggers are going to be, you literally time out your life from when you earliest recall it. What was your life like? Big moves in your life, transitions from school, social situations that might have brought stress on in your life. And you literally plot a timeline of it. And they make all of us do it ourselves, which was like very eye-opening because you can go back and really truly look at what were some of the things that kind of like, when is it like the last time I felt good? When is the last time I felt, well, what was going on then? And then when is it that things started to change? And when you really take the time to plot it out, you'll see some big triggers that have probably happened. Mediators are going to be consistent things. Like if your diet is, we call it the standard American diet, high in processed foods, basically, and sugars, refined sugars and processed carbs, right? If there are certain stressors that are still in your life, maybe it's an unhealthy work environment that you're still stuck in, but those are the things that are still consistent kind of throughout the path. But the goal is then when you look at this graph, this kind of history, very comprehensive history. A good example would be you have let's say 45-year-old female who is a single mom to 2 or 3 kids, busy lifestyle, right? She's working, she's taking care of her kids, eating a lot on the go, has probably more than 2 cups of coffee a day. Maybe she's going to pick up some type of iced, sugary, high blended coffee too.
She's not eating breakfast.
Right. She's skipping. You're right. She's not eating breakfast.
Because she wants to save those calories.
Yeah, right.
I mean, I could go on and on, but yeah, go ahead.
Exactly. And she's living on the go. Sleep is probably somewhat disrupted too. Maybe that's the time she's up to, has some time alone for herself. She's cleaning up the house, or she's staying up late watching Netflix, whatever that is. So that's impaired for her too. So doesn't really exercise too much because after work is time for kids and homework and bath and all of that. So the same person will then, she's driving. And she goes and she's driving and she gets rear-ended. Okay. And she's in a car accident. She's okay. She didn't hit her head, didn't lose consciousness or anything. But over the course of the next 2 years, she starts to come and see you as her doctor. And she's starting to complain of headaches, joint pains that weren't there before. She starts complaining of, I'm just tired all the time. Maybe there's some mood changes that she's describing. And so in the traditional route, when you take that patient in, not all, I don't want to label and categorize everybody as the same because it's not, but you could look at that and see, okay, I'm going to treat the depression with this medication. I'm going to go and I'm going to check for some antibodies for the joint problems and see, did this person develop any new rheumatologic disease? Okay. So you're trying to come up with diagnoses and treatments kind of based and silo everything off. But if you take this same story and you plot it on this timeline, and you can really see from this history, this is somebody who was living in a very stressed state. She had probably a lot of, maybe her cortisol was high, or maybe it was depleted at some point too, because if she's really running on empty. She was filling herself with the standard American diet. So this is going to reflect what is in her gut microbiome, what's available there. And so then you have this disruption on life where she had a car accident. She had some jolted physical activity. This, you could change this out for, she caught the flu. She caught COVID. You could sub out whatever this triggering event was. Then you now have this person coming in with these problems. And if you just step back and look at the bigger picture, the way to help this woman, the way to help her, one, is to hear her. And there's fear in what she's telling you also, right? She's a single mom. If she can't perform, there's a downstream effect. If she's depressed, there's a downstream effect of that. And that is literally like when you can help this woman and approach this woman and say, I get it. I hear you. I hear you. And I'm not going to call this just perimenopause. I'm not going to just call this, you need to lose some weight. I'm not going to call this, you just got prediabetes. You're just not taking care of yourself. That's the wrong way to look at this. But to hear her and then to come up with a plan, which is really the part where you need the buy-in of your patient. We're going to do this together. We're going to make a plan together. It's not easy, but we're going to step it out accordingly and personalize it to you. That is when you do it and your patient buys into that and works with you, that's the part where I've seen both this functional medicine, this longevity medicine care that I want to give to my patients. That's where I see it blossom.
Well, and I think from my perspective, because we're not following the exact same path, but one of the things that I have noticed is with my patients is that if they feel heard, like if you listen to what they're saying, even if their approach is something that you would not recommend, when you can hear them and they know that they're being heard, sometimes as they're talking, they're like, oh, I see this is probably not the best thing. I'm staying up till 11 o'clock or 12 o'clock every night. It's probably not in my best interest. They hear it and because they're talking and you're listening and inquisitive and asking. And that right there, I think is enough to get some buy-in 100%. Because so many practitioners they're talking to and they're just, I've seen a doctor before where as I'm talking to her, she's not even looking at me. She's just typing on the computer as I'm talking and she's standing above me. And I was like, I'm not sure what's happening here, but I'm not coming back. Just because I didn't feel heard. She may have been listening. I don't know, but I have no idea what she was typing. But whenever you can hear someone and hear their story, it makes such an impact on their ability to say, okay, I'm here and I'm ready for change.
Exactly. Whether you're looking at it from someone who's coming in with a problem, okay, or whether you're looking at it as I have someone coming in truly wanting to know what can I do to take better care of myself. That's where this blend of, and you can call it traditional with functional with anti-aging, all of it together. That's where you can really use this information to help people. So it's my responsibility to be on top of my game. I need to be the most educated as I can with what information we have today. And that's evolving. As we grow and learn more, we need to practice better. We need to do better for our patients. Whether I've had men come in and, I think we're in a tough world right now with extremism, right? On both ends. Okay. I've had people who are very emotionally charged when they've come in to see me. I am very much against, they'll come in and say things like, I am against, I'm not taking any medication, at all, but I'm only going to treat things with supplementation, or I'll have people who will say, I don't want anything except, diet or lifestyle stuff only. If you even mention a statin to me, I'm out of the store. And you'll see there's so much emotional stress and triggers coming in. But when you sit down with somebody and you just tell them, okay, I got it. I hear where you're coming from. I understand where you are. You don't have to do anything, but I'm here to help. I want to help you. And I think the part for me, like the biggest calling, I'll tell you guys, like that is on my heart is in my true heart. I really feel like I was put on this planet to help people and I don't know what all of that yet means, right? I don't know the full capacity of what that means, but they're coming in to see me. They're trusting me with their health. And if you don't have your health, you don't have anything, to be honest with you. And it is the most beautiful relationship and responsibility that I have to see them through. It is, it's a privilege. And I've seen that, I've respected that. I mean, whether it is in the beginning of your life, when I'm seeing people more kind of around 16 to 18 in the beginning, all the way to the end. I'm taking care of the grandparents in this situation. I'm taking care, you have a family coming in to see you. So much of what we're coming in with is a fear. And if you kind of hear what that fear is for the person, I'm scared I am going to get Alzheimer's. I'm scared I'm going to have a heart attack. I'm scared I'm going to be dependent upon my children or be their burden. When you hear it and you can see it and you can then discuss, we are going to do everything in my toolkit and my power to help you age well. That health span part of it is it. It's a huge responsibility. And like I said, I truly feel it as a privilege to be there with them, because I've had people tell me, they're like, hey doc, I see a couple more grays over there. And I'm like, yeah, we're both getting older. Like we're doing this together.
Yeah.
So I have to practice what I preach. We gotta age well together.
So you've mentioned aging a few times.
Yeah.
How does that blend into, I mean, I think you might have just answered it, but how is your approach to aging different whenever you're looking at it from a different lens?
I think that in primary care, we have had these like standard guidelines for, the U.S. Preventative Task Force comes up with these standard guidelines of when you can do some screenings for patients and based on this age. And, and there's data, a lot of data that they have to go behind that. And I might get grief for, what I'm saying, but I don't necessarily agree with the timings of some of those things. And I think that in each field, whether it's neurology, whether it's endocrinology, rheumatology, primary care, GI, gastroenterology, we've lost in traditional medicine a little bit of preventative measures in each of those fields. And myself included, for a long time in my practice, I was operating from this place of, we're going to do these things. When now I can say, oh my gosh, that was the bare minimum of what we needed to do. So, for example, Dr. Peter Attia, if you all listen to him, he's probably been such a positive influence in my life. He talks about the 4 horsemen that we see with aging in this world, and how our job is to try to create the best health, the longest that we can, before the natural drop-off that we can't prevent, okay? He calls that health span. So the 4 horsemen, I think he says, are metabolic dysfunction, cognitive decline, cardiovascular disease, and cancer. Those are the 4. And so it's kind of like creating, so how I see the anti-aging and prevention in here is looking at those 4 horsemen and seeing, okay, what are we doing in terms of cancer? Why, what are we doing? So if I have a young woman who comes in, it's my responsibility to make sure we talk a lot more about this family history. If she doesn't know, you need to go back and ask and come back and talk to me. I'm having young women do their Tyrer-Cuzick score for their lifetime risk of breast cancer. Let's find out early what your risk score is. And when you fill that out, which is it's a free calculator online, I want all women at least age 30 to start doing this. Find out what your risk is. Average risk is around 10 to 12%. You high risk? That might change not only how and when we screen you. Do you need genetic testing done? Okay, that's part of this. For colon cancer screening, right? Age 45, we have modalities of Cologuard, and we have screening colonoscopies. We have other modalities that we can use. What if you have a family history, or if you have not just colon cancer, of polyps? I have inflammatory bowel disease in my family. That does change things of when we need to look. So those are just examples of, in cancer prevention, how and what we do. And, I think there's a big cost concern. How much is genetic testing going to cost me? It's amazing how things have changed.
The cost of genetic testing is minuscule in comparison to the cost of having to treat cancer because it wasn't detected or looked at even being a possibility early on.
Correct. And a lot of these companies, these genetic companies, have, if you have done your lifetime risk score calculator and you are someone who's intermediate to high risk, a lot of them are either partially covering. There's some assistance with that cost. It isn't what it used to be. This doesn't just mean blood. It could be a swab in the cheek, things sent to your home. It's not as far-fetched as this was maybe 10 years ago, right? When it comes to cognitive care, I think all of us, especially women, we are so much more prone to Alzheimer's disease than men. And I think that's kind of this surge of interest in looking at hormone care has also come into play here too, right? Why is that the case? Why is it that we are in your traditional world, we're not talking about everything that you can do? I've had patients will seek a counsel of a neurologist to talk about this family history, and they'll come in with some supplements and they're met with, none of that's proven to work. And that's, I think you're closing that door. And that's what we have to stop doing, because then you have people who are extremists who will say, if my specialist with the MD behind their name isn't going to tell me, then I'm going to go on the internet and go and search. I'm going to ask Tom and Sally and
ChatGPT.
Yes, everyone else what to do differently. And so we can guide this conversation, but we have to stay on top of our research. We have to learn. We have to practice this. That's really big on my heart. When it comes to, for women, I think, osteoporosis, prevention, we are in this world again where we had these medications, some of the same medications out for a long time that are wonderful and great. But I have most women that will come into my practice saying, I've heard so-and-so had this problem with this. I've heard so-and-so had this problem with this medication. They're right. Those people did have problems with that medication. Doesn't mean that you will. But why are we waiting till you are 65 to start screening your bone density?
That is wild.
Wild. When you have gone through menopause, average age of 51, 52.
Yeah.
Why aren't we looking at this, maybe getting a baseline mid-40s, waiting a couple years again, closer to menopause, or when you've gone through your first year without any menstrual cycle, doing it from that date and looking at what that decline has been. And I will tell you, so far I'm seeing women who are in their mid to early 40s already with osteopenia, with bone thinning. And when you step back from just the diagnosis, right? And you look at what drove this. That's, again, it's not just a nutritional problem. That's part of it. There is some inflammation. There is the bucket of hormone decline that they've experienced. So there is a microbiome piece to this, a reabsorption, all of that. So you have to treat this from all of the angles. The exercise component are lacking. And my hope, and I know my partner, Dr. Cobb's hope, is we want to create, and just like you all, a network of like-minded professionals and people who are going to be open to learning and making a change. I was at my son's basketball. We are hardcore basketball. Okay, we're going to the NBA one day.
Yes.
I'm kidding. That's a dream. Okay, no, but I was sitting next to a mom who is a physical therapist, and there is this really beautiful study that was done in Australia for bone density, where they took women who were at the average age of 60 with osteoporosis, and they put them through a twice a week, 30-minute physical therapist guided regimen of weight-bearing, load-bearing exercise. And they showed within 8 months a significant improvement in their bone density. So you were already at a place, and that was the only intervention done outside of optimizing calcium and vitamin D intake. So you took women with this diagnosis over 8 months, twice a week commitment, 30 minutes, but guided, and you saw improvement. And so I was talking to her a little bit about, who in Lafayette does this program. And one of the first things she said to me was, I wonder if you can put osteoporosis as a diagnosis for needing physical therapy, or would insurance, and we didn't get to follow up on that. You could, but even that component.
Right. Because the prevention from an insurance perspective, I mean, obviously I deal with insurance, but I'm not in the decision making of insurance, but it would make so much more sense to prevent the problem from happening than to have to treat it afterwards.
Exactly.
A lot of money.
Exactly. So it's, and even when you're talking about supplementation, does it have to be supplement, or is there a dietary thing that we can do for improving those levels of calcium in that woman or that person? Would that be better? That's that bucket of things with osteoporosis and bone prevention. The other horseman, metabolic dysfunction. That's a big one. A big one. And what we're learning today, markers of inflammation, markers of problems, looking at the GI, you've got GI map testing and PCR and studying that to see how that plays a role. There's a lot to it. And I'm not going to lie. When I was like, there was a part where I myself was buying quite a few supplements. Okay. And I stepped back and I said to myself, okay, can you do this nutritionally? Is there some things that you can do that are truly lifestyle, that are more sustainable than it became like a beverage of supplement? You know what I mean?
Right.
Like I'm sorry, breakfast of supplements. So it's just, there's so much more. And like I said, as you start digging, more and more will come.
It's unfortunate that there are still so many physicians that just don't want to dig deeper. You just brought up the GI mapping. A couple years ago, I did the GI mapping and some micronutrient testing, and I had some markers on it. So I brought it to my physician at the time, and she told me, none of this is based in science. I'm not even going to look at it. And I was like, okay, well, that's really annoying because, you pay to go see your doctor. And so I actually did the GI mapping with Daphne, and I had a lot of markers, inflammation and some different stuff. And she's like, this is beyond what I can help you with. You need to go see a GI. So called your husband's office, and I didn't know him at the time, and kind of told him what I was trying to get to the bottom of. And they're like, I think you need to see Dr. Bro. So I go into his office, and it was the first time that a doctor's eyes didn't glaze over when I brought functional tests in, and he got not excited to see it because it was bad, but he dug into it with me and started talking about lifestyle and diet and how you guys raise your kids and all this stuff. And long story short, that MAP test or GI MAP test saved my life because he found a 3-centimeter polyp in my colon, and I was 35, like not old, 10 years before I would have ever had a colonoscopy. So probably had it been in there much longer, it would have been full-blown colon cancer. But anyway, all that to say, it's so refreshing to see physicians want to learn more and dig deeper past what they have, been taught to do. And, it was a test that he didn't order and they didn't get paid for or anything like that. So
exactly. I think it's, you want what makes me scared is when, if people are going to turn to non-validated sources for information, it's scary. I'm telling you this as a daughter. I'm some. My mom and dad. My mom has started taking supplements that she's ordered, and I'm like, "What are you doing, Mom?" And you read it, it's like 40 things that are in this, and you worry a little bit. My dad's a kidney specialist, so he looks at it with like a fine-tooth comb, and he's like, "Oh my gosh, this could affect this." Then
you have the flip side where currently, in this moment, my dad's in the hospital, in a rehab hospital. And whenever I look at his labs, just his CBC, I'm mortified because it looks so like, I'm not going to get into the whole thing because I was really fired up on Saturday and it ruined my day. So I'm not going to do that to y'all, but it looked really, really bad. And he's been in the hospital for 2 weeks now, and it's looked the same the entire time. And I've asked a couple of nurses, I've talked to the doctor, and everybody's like, yeah, it's fine. I'm like, no, but he has pretty significant anemia and he's passing out. Those two things have to be related, right? And nobody will hear me. And he's a 75-year-old man. He's in really not good health at all. But this is something that could easily be addressed, and it's not being addressed. And so he's just prolonged in the hospital now for 2 weeks.
That's terrifying. It is. That's the part. And then subsequently, you'll lose faith in some of the system, right? And so that's the downstream effect of that, not just for what he's going to acutely go through right now, but of what you're seeing, what the people in your life are seeing too with that makes us lose faith in it. And I think when we, like in traditional practice today, it's all of my colleagues in primary care. I mean, it's a tough place that we are in. And I want to tell you that, at least for me, if the intention is not to help you age better and feel better, we're missing the mark. We have to level up with that. And so what I'm beginning to see now, which I'm excited about, there was a time when you would have to go to New York, like a big city, the big city to get the good care. You have to go to Austin, Houston, New Orleans to find someone who, studies functional lifestyle, longevity. We'll add this. The Peter Attia is out there, right? I'm sorry, I keep bumping this. And a very hand discussion person. But the good part that I'm seeing now is like I was mentioning that we're trying to, this network of people here. I've had some of my patients who've gone to their cardiologist in this city, very good cardiologist, who will hear their patient say, I don't want to be on a statin. Okay. And they won't instantly, they might internally have like a full, cringe of because what they're seeing on their side is death. They're just seeing, look, we didn't do enough. But you'll have someone who's now more knowledgeable about, is it just the fat content that's in circulation? Is it the inflammation of the endothelial lining of the vessel? What is it? How do we approach both? And they're willing to work with you on this. They're willing to do additional blood work, lipoprotein little a, ApoB, homocysteine levels, and they're willing to look at that. And then they're also saying, okay, here's what nutrition plan I need you to follow. Okay, you want to do this. And everything has to become more personalized, right? And I think that's the thing. I had someone come in to see me about a week ago now. And around, I want to say early 50s male comes in, and main complaint is fatigue. Okay, I mean, how many of us, it's probably everybody coming in with fatigue. And, he's not very excited to talk to me. I mean, it's like hard, pulling out information and getting this timeline on him as far as what was going on with him. But there, in this discussion, he even told me like a year ago he tried to be on mostly keto, thinking, okay, I'm gonna cut out. I've heard enough about these from podcasts and YouTube, and I'm gonna cut this out because that's the first thing my doc's gonna tell me. It's all that refined sugar carb. So he did that, and he didn't feel good. He still didn't feel more energized with that. He has sleep apnea. It's being treated. He had his machine tested to make sure that there was no air leak, that he was getting enough pressure for proper sleep and all of that. So he had already tapped into that. So he comes in and he says that to me. And so from there, we pull apart with his story, talking about today what he's eating. What happened on the keto diet was a lot of foods that are on the keto diet can cause a histamine reaction in the body, avocado, eggs, which are they're wonderful foods, okay? But again, one size doesn't fit all, right? And so I just think that, and we looked at all the variables and created a 1 month plan. And in 1 month, he'll come back. We'll come up with the next section of transition. And so my hope is that we get to create a network of doctors in this city where we can talk together, and physical therapists and nutritionists and chiropractors, everybody, because I can't know it all. I can't do it all. Nor can someone else, nor can the local, GI or neurologist, but have this network of people to tap into seeing what can we do to optimize this patient. That cardiologist that I'm talking about, when I tell you my patient in a year came back, okay, high cholesterol, that guy came back, beautiful cholesterol, lost some weight. But the first thing he said was to me, the energy he had to keep up with his grandkids. And you could hear maybe that was the fear or the goal. He saw people sitting in the waiting room at the cardiologist's office that he assumed are on these medications that are feeling like this, okay? And he pushed, I don't want to do that. I don't want to do that. He didn't do it. He made a huge commitment to himself to try to do this lifestyle and look at all the variables, some supplementation in there too, committed to it. And he comes back and he's like, I don't think I have to become that.
I think personally, as a patient person, there's a huge responsibility on each individual person. Some of that responsibility is shared with practitioners. And as you mentioned, there's no one practitioner that's going to be able to fix or do everything. So we do need the network, but also the community of people. So we don't live in a society, in a community here where health is valued. And I've seen changes and transitions and shifts over the past couple of decades, but as a community, I think each one of us has a responsibility to just level up a little bit and make the community easier to be healthy in. So, of course, I'm going to talk about food because that's what I do. I think about food constantly. But whenever we have places where the workplace is purchasing lunch that is boudin balls and po' boys, as a community, for someone who's going in and trying to be healthy, and that's what the presentation is, like, okay, well, this is what I got, So as a community, I think we all need to level up just a little bit to be able to make it easier for the next person. And I talk about this a lot with individuals whenever they're talking about social gatherings, and they're going to a social gathering and they're the person that always brings the cake. They've got this special cake, blah, blah, blah. I'm like, okay, well, what if we shifted that a little bit and we did something to make it better? Maybe instead of bringing cake, you decide that you're going to bring something else. I can assure you that you are not the only person who is going to be thankful that there's something different there. And nobody wants to talk about that. Nobody's going to go into a social situation and be like, oh no, I'm being healthy now, but we're just going to try and mold and fit into whatever's there. But we need to help ourselves and help everyone else around us to make it a little bit easier. I think our community here is one of the biggest challenges in any individual trying to move forward in their health.
I don't know if you bring a special cake every time and then that one time you don't bring that special cake,
Dustin's going to pitch a fit.
I'm going to riot. No.
Well, depending on people's personality, I would say, sorry, sucks to be you, but not everybody has that personality. So some people would really want to make you happy and bring that cake, and they would sacrifice themselves.
You're so right. And like you said, it starts with you. It starts with when you eat certain foods, how do you feel? How do you feel the next day? How does that nourish you? It's funny. Kids are probably the most humbling experience of life. I feel like kids level the playing field for like everyone in their life. You just have them. If you're blessed to have them. I will say that when it comes to nutrition, right? And I'm very lucky. My spouse is he's very strict and healthy, and it does create what are we cooking together as a family?
Support system.
It really does. But it's funny because kids are kids, and they want, I was eating Pop-Tart. I was doing everything as a kid, Lucky Charms. That was, and so trying to create that effort, knowledge-based, what's your protein are you having with your meal? Simple things like that. Okay. How about what kind of fruit would you like with that instead? And then without giving them a food issue, right? Also later on saying that something is bad necessarily. But it does start with asking yourself, how do you feel when you do that? The patient I was mentioning, or I'm going back and forth, but my 50-year-old coming in with fatigue, right? Just taking that, asking himself, like, when I eat this food, how does that make me feel? When I exercise, how does that make me feel? Because we go sometimes from doing everything, we're going to exercise, we're going to eat right and be on this thing, to then we say, it's not working, stopping everything, And like, why can't we make small changes and habit stack them, right? Or, I was thinking about that today, about routines, like before I was coming here. The routine, some people think that I'll have patients come in and say, oh, well, you work out in the morning? I can't do that. I have no time for that. I can't do this. And I just say, like, what if you woke up 15 minutes before your kids, or before going, 15 minutes early from whatever you were doing before, woke up, and you lit a nice smelling candle, okay? And you wash the dishes. You didn't wash them last night. That's what you do anyway. First thing in the morning, you wash your dishes, you load the dishwasher. But you lit the candle. You build from that. It gave you a moment of, like, it feels good, it smells nice in the house, okay? You build from there. You drink a glass of water. But every time you do something like that, register it in your bank account, like, this is for me. This is for my well-being. It's my, everything. I've seen a nutritionist before, and she was telling me after work, when you come home from work, because I was telling her that's my craving time. Like if I want something to eat, that's like, she said, your stress was high. You're bringing in the kids from school and all this stuff is about, you got homework. You have dinner to make and the house, all the dogs, everything. She just stopped. She's like, make a cup of tea. And I was like, I don't like tea. She's like, just do it. She's just like, just try it, you know? And she's right. Like, it was literally 10 minutes. Kids are doing whatever they're going to do. They're fine. Everyone's okay. And just have a cup of tea and just stop and just take a moment. It's these little habits like to build on and own it and see what you're feeling with that and take account and take stock of that is. But as a community, we have to change that dialogue that you're not being the outlier healthy one. You're just trying to do what feels good for you.
I think when those little habits, so they both know that my philosophy is inch by inch, life's a cinch. And those little habits, whenever you do it and you are consistent with it for longer than a couple of days, you make the commitment, you gain so much confidence in yourself and your ability to do something that you thought you were not going to be able to do. And once you gain that confidence, it starts momentum like, oh, okay, well, I can wake up in the morning and have a glass of water before I go for coffee. Like that is something that is easy enough. I can do that. And now that I feel a little bit better, maybe a little bit less foggy to start the day, maybe, just maybe, I have the confidence, because I think so much of it is confidence, to be able to do whatever the next little inch of a step is, like the next little thing, the next little habit. Now maybe I can, bring something for lunch. That's kind of a big one. But you gain that confidence in your ability to be able to set a goal, a small goal, and then achieve that goal. And every time you do that, it's like, okay, well, this is possible now.
Yeah, trying to overhaul your whole life. We say this all the time. Trying to do all 20 things that you need to do at once is completely unsustainable, especially when you're going from zero.
Exactly.
So just making small changes, little bit at a time, build up your confidence. And then in 6 months, you'll be working out, drinking your water, doing all the things.
Yeah,
exactly. It's so important that we build it and we individualize that to what, if something doesn't make you feel good, don't start there. Start with lower. I told someone not long ago who's going through some depression. We talked about and they were so busy and they were coming that when I met them in the office, they were so closed off. They were like, I guess truly hopeless. And they're in one capacity, like just didn't want to hear it, but wanted to tell me how they were feeling. But like, there's nothing you can do. There's nothing that's going to make it better. And I just said like, okay, when you wake up tomorrow, just go outside. What time do you wake up? Okay, 6:30, sun's beginning to come out. Just go outside. Go in the morning light, 5-10 minutes, 2 minutes. Just do that first thing and build from there. And it is a big confidence thing. It creates motivation. And it's beautiful to get aligned to that. I've seen more and more people in my neighborhood, wearing their weighted vests, right?
All the cool girls,
right? I've seen, even at work, at the hospital, I'll see people on their lunch break walking for 10 minutes, just walking and doing that. And even when it's hot, they'll walk with their umbrella, but it's just so I'm hoping our culture and especially around here does change and move. But you're right. If more and more of us are brave enough to say, I'm going to do it, then maybe it'll catch on.
Yeah. So it takes one person to kind of build their little community around them and to be brave enough to do something different from what everybody else is doing.
Yeah, exactly.
As millennial moms, I feel like we were the ones that had the instant mac and cheese and all that stuff when we were growing up, and it's catching up to us. And the way I raised my kids and feed my kids is completely different than how I was raised. But I had a single mom and, I was a latchkey kid. But I think we're going to make some changes, but our children, I think they have hopefully the best chance to break this, because at least my little circle of people, we're so mindful about what we're putting into their bodies, and they're learning. It's completely okay for your kids to understand proteins, fats, carbs, food dye, like what the foods do to your body without, like you said, causing food issues.
Right.
You know, just making sure that they understand age appropriate levels, and that will set them up for success in the future.
I think you're right too, like so right on that one. And whenever you say like the millennial mom thing, I think I've had these like moments, probably a lot over the past year, where, you know, sometimes I think, you know, life is funny. Life is just very funny. We go through this, you know, transition when we have our children. I have one of my best friends is my cousin. She's about 10 years older than me. And so she's in the phase where her kids are leaving the house now. And she also, so she's going, you know, we're going through menopause fully at this point. We are, kids are leaving, parents are aging, right? And you have this person who is, you know, there's so many, let's put all those pieces together. There's, you know, all of those emotional triggers, hormonal triggers that have been going on and brewing, the diet, the sleep, the stress, the getting through the SATs, and now my kid's going to go off independently. You know, all of this. And one, it's these like having one is having a doctor to work with you along your journey to fill the buckets that are depleting in some capacities, helping them with their hormone care, helping them with their nutrition, their sleep quality, using the wearables, use your Oura rings, use your continuous glucose monitors. Let's get you set up back on track with it all too. To optimize this time, to keep you in the best health to try to go through this next experience. And I think your kids throughout this point, like even as they are younger to this age, they see it. They were watching us, right? I don't know if they're going to listen to anything that we say at this point.
My 17-year-old, no.
Okay.
We're laying the foundation.
Right? Yeah. I mean, he goes back and forth between he wants Hot Pockets and he's dumbfounded that one of his friends does not eat vegetables. He's like, how can this kid not eat vegetables at all? I'm like, all right.
It's like bringing them into the gym. Like we made our little garage into like a little workout space. And so bringing them into there, and I'll see my cousin who has the older kids now too. That's how it started with her. She brought them in there. So they're leaving, they're going off to school now. They have a concept of nutrition relative, right? Protein, starting with that. Maybe the reason is to, you know, to get shredded or whatever their reason is. Okay. Yeah. Right. Whatever that, you know,
yeah.
But, it's starting somewhere and they're seeing that. My kids will you put them in the gym long enough, they're going to pick something up.
Mm-hmm. Yeah.
They're going to play.
They're going to play. And then they see you doing it and there's no devices. There's no, you know, it's just this dedicated time of you taking care of yourself. I think that's so valuable, you know, to build
Absolutely.
from there. Yeah.
And just the confidence, at least my oldest daughter has celiac disease. So she's very strict, like because of me, but she's also very strict on her own. And she'll bring healthy stuff to school. And if I would have done that when I was 8, 9, I would have been so embarrassed, you know, and just teaching them that it's cool to take care of yourself and you're not weird to have vegetables in your lunchbox. You know, she just... sucks for them that they have Hot Pockets or Pop-Tarts for lunch, you know? So it's without being judgmental towards other people, but just understanding like, well, I'm doing this because I want to take care of my body. And kids are so sensitive to their peers.
Things really have changed because I used to have the taco Lunchables
Healthy.
Yes.
and Taco Bell sauce with it, and like that was the cool lunch to have.
You're right.
Or like you have taco and pizza. And,
Yes.
yeah.
Like Taco Bell got me through college, but
Me too.
today,
Honestly, me too.
right? It was $1 for a taco. So
Not anymore.
no, that's true.
Oh,
Inflation.
I know. One of my big things for myself is I'm working on my bone density. I gotta, you know, I have a lot of osteoporosis in my family. So I'm trying everything I can to look at my body composition and exercise in a way for that. It's less of that vanity component to it and more of like functionality. And so, and I'm looking at these exercises, these studies that say, okay, do this, do these, this is how you need to load the weight. And then like I'm in the gym doing these, you know, these hip thrusts, all this, whatever, deadlifts. And I just see how my kids are moving. And I'm like, they're just naturally like how they play and how they move.
Right.
They're supposed to do that all along. I'm looking at one of them in a deep squat and I'm like, this is supposed to be a hip mobility stretch for us. And I'm like, oh my God, you're just sitting there for like 20 minutes in this like deep squat, position. It's
it kind of makes me think like we were never meant to stop doing that.
I was about to say that.
Exactly.
We could move that way 30 years ago too.
Exactly. Yeah. So that's that part. I honestly, like my patients have become I'm like I was telling y'all earlier, they're everything for me, right? They're my people. And so you see, when I have people who come in to see me who are in their 90s and there's no walker, they drove themselves here. I'm sitting there the whole time and I'm like, okay, we're going to get to your step, but tell me first everything you're doing. What are you doing? Like, and it starts with, they never stopped exercising. Maybe that's yoga. Maybe that's now being and they're going to some, heated pool at a therapy location in town that they have a membership to. They never stop moving. That drive within them of wanting that independence that's the thing too that won't stop them. I'll have people of all ages come in and say things like, maybe it's I can't eat like that because my spouse won't eat it. So I can't cook like that. That's not going to happen. And you try to negotiate and you're like, okay, well just make the same protein and just, steam a vegetable side, very simple for you. And then your spouse can have whatever carby thing too, but even just separating that, it's like we get these strongholds that we build on ourselves of like why we're not going to do something. But when I'm looking at the will of these people who are aging so nicely, it's just like their desire outweighs
any inconvenience.
Yeah.
Well, it's also easier to do something that you've been doing versus you stop and you have to start new habits. So if you just always move and always eat healthy, obviously that will be a lot easier.
It's for everything, I know.
Yeah. It's always the start though. I mean, change is hard always, no matter what the impetus for change is. I think whenever I used to tell people, whenever your doctor sends you to me and the desire for change is coming from your doctor, the outcome is less likely. A positive outcome is less likely versus someone who says, okay, I've been told this, I've seen this, I've, read this, I know it's time for me to change. When they come in themselves, then we're much more likely to make change faster because they've committed, they've recognized, yes, this is going to be hard, but the beginning of anything is always the hardest. And I always will give the visual of if we have a boulder that we're trying to move, you rock it, like this doesn't work. And then finally, whenever you move it, you just keep it going. You just have to keep that momentum going because that's much easier to do than to start from a stopped boulder. So any type of implementation of change is hard, but once you do it, then it just becomes easier and easier.
That's exactly right. And then even when you look at it from like the plan that we come up with for in primary care and internal medicine, this practice of medicine that I'm talking about now, it's exactly that of we have to, whether it's your testosterone is low, whether you're going through menopause, we have to we have to optimize those hormones. We have to supplement appropriately the diet, the sleep, the movement component too, the spiritual, emotional stressor component, which is huge on all of this too. We have to put a little bit in each of the tanks because it's not going to be just one. We're not going to just, there's, I have quite a few people who will come in to ask me, hey, I need you to give me, I want to be on TRT, testosterone replacement therapy. So-and-so is on it at work. They're feeling so much better. And they're not wrong if if we look at the pros and cons to that and we look at their levels, we can say, okay, we do need to optimize it. But it isn't a one size fits all. If I give testosterone to one person, I have to think of what that's going to do in this person. Look at all your risks and benefits to it, the downstream effects to it, and make sure that goes well for you, as well as what drove that level to be low in the first place, right? Same for women who are going through hormone changes with perimenopause too. Thank God this new information has come through. Dr. Mary Claire Haver is talking so much about it. I'm so lucky we're in this place where you have board certified doctors bringing this into the forefront. But you optimize their hormone, but that's not where it stops either, right? So, but you're right. Once you can replace it, they start to feel better. Add on the other things. Add on to do both. Treat the person in front of you and build their momentum to want to take care of themselves. Has to be the end goal. That has to be it, But when you see it come out together, I'm sure I've talked to several like lifestyle medicine doctors and all that, and I've asked them before. I said, "What is it that makes? How do you get your patients to do it? Like what?" And they'll tell me by the time they've walked through this door, they've looked up they've bought in. They want it that bad. That desire's that there. So it's a great thing.
Daphne and I, we have a corporate wellness program that we do, and it's a 6-month program. And obviously, diet and nutrition are very important things for our health, but we save that for the absolute end of this program. And we start with like your stress levels, practicing gratitude, your sleep, like little foundational things. And by the time you get to the hard stuff, it seems easy because you've already done all the little things.
Momentum going.
So just that same concept.
It's building. That's it. Building a good practice and having a strong foundation to stand on.
Yeah.
Yeah.
I think so many more people, practitioners and people in general, want the best of everyone. So we don't necessarily, I would say that it is a common thought that in traditional medicine, the way that the model is, that the doctors just want to herd you in and herd you out. And I don't believe that to be, I think that is kind of what we've gotten to, but I don't believe it's because the doctor doesn't care. And so it's certainly there might be some that don't care as much, but from a practitioner standpoint, there are so many different types of practitioners that are so willing to help someone just take the next step. And so as practitioners, like you were talking about, building the community of practitioners that are willing to help somebody just take the next step to make it easier for them. And I'd say that with practitioners, with some of the lab companies, like you talked about, some of the physical companies. I mean, there are so many people that want the betterment of humanity to improve. And so we really kind of have to latch on to those people and use it as building that foundation so that we can all level up. It makes it easier for everyone to take that next step up.
That's when that happens. Gosh, that's so. There's so much I think when you bring that up. One is this extremist view from everybody. And I've been in the place where I want to say probably in the beginning of my practice, I had patients doing extensive like cholesterol panels through Boston Heart, and they would bring it to me, and I'd look at it like I don't know what half of this means. I didn't learn this. I learned this very basic lipid panel that we've been going off of for this many years. Now I wouldn't. There's not a patient that I don't say today we need to do this. It's not covered by insurance, but we need to get this on you. But I think it's this, when patients are coming in with everything about the traditional Western practice is wrong or is, I think that's not good. There's, I think when you come in and you are questioning and doubting everything or thinking, patients told me, I heard you're going to get a kickback and I'm like, where's the kickback? So that kind of blows my mind. And that's hard. The best of people with the best of intentions, that's awful. And there is a role for medication. There is. And I won't stop believing in that, including cholesterol medication. There is roles for those things, but it's, the missing component is the education behind it. Right. And so, and if that's all you're coming in and I'm just loading you up with meds, that's wrong too. So the patient's perspective of one, you're right. Like you said before, you need to be heard. You need to be listened to. You need to know that the doctor you're going to see is going to take their time to listen to you and meet you where you are. And you have the option to say, no, you don't want to do something. And that doctor will hopefully meet you where you are and build with you. It's a trusting relationship. I usually see the most trust probably after a year year and a half where patients will then say like, just tell me what to do. But in the beginning, it's like, feeling you out, which I understand too. On the other side, I've seen a lot of practitioners in the area or in general who will, kind of like demonize Western medicine too, right? Not just so they'll say, oh, they don't do this. And that like, instead, I wish there was more, people just coming together on this one and maybe picking up the phone. Hey, this is what I'm thinking about for your patient. I'm working with them on this nutrition front for them. I'm seeing these problems. This is why I want you to order this testing because of this. Sharing that education and stuff. And so when you can start doing that, like the number of times I've picked up the phone and called someone and said, just tell me what you're doing. People in our area, Dr. Ed LaFleur, pick up the phone, call the guy. He's the nicest man in the world. And ask him. Kelly Cobb, she was probably the biggest influence for me of with functional medicine and hormone care in this area. Devin Sapansky, who owns New Well Clinic, family medicine trained physician who now started reformative medicine, where she's looking at gut mapping, she's looking at genetics in addition to Western lab testing, right? They're out there. We can use them and learn from them. Chiropractors in this area, we can learn from each other. But if we start demonizing everybody and that's not going to move us in the right direction,
Before we let you go, we ask all of our guests one question, and that is, what does living vividly mean to you?
I think for me, over the past couple of years, I'm learning now that my relationship with God has shown up to be the most important place for me, because it's when I start my day and I just start saying, I'm so thankful. Thank you for the little people in my life. Thank you for the opportunity to practice being a doctor. Thank you for being able to walk, drive, be independent. When you start from there, you just truly, like whatever spiritual connection that you have, that truly has become the biggest change in my life that I'm seeing now more than ever, who's guiding me and helping give me the courage to make these changes for myself too. That is number one, creating that routine, habits that make you feel good. And then the last one is having laughing. Like I have, whether it could be, if it's through some YouTube short or meme or something that makes you belly laugh. I have some very, very good friends in my life who you just laugh at yourself and just enjoy that. My spouse too. It's like you've been with you for so long and it's like you've seen each other through all the things. And life is short. Enjoy it, live it fully, enjoy it and appreciate it, because, it's not tomorrow's not guaranteed. So I think those are my three.
Thanks for listening to Living Vividly. If you enjoyed today's episode, please leave us a review and subscribe. We'd love to hear from you. For more resources and details from today's discussion, check out the show notes. Until next time, keep living vividly.